Hello, everyone. We will go ahead and get started. Thank you for joining us on this wonderful day where we honor and celebrate and consider International Women's Day. My name is Dr. Rachel Vreeman. I'm the director of the Arnhold Institute for Global Health at Mount Sinai and the chair of the Department of Global Health at the School of Medicine at Mount Sinai in New York. And it's really our privilege to be able to gather global leaders at times for conversations such as this one to talk about critical issues. And today for International Women's Day, we're delighted to turn a spotlight towards the issue of gender equity in Nepal. I'm going to introduce our two esteemed guests that we have with us for this discussion today, and also just tell you a little bit about how we come together in this partnership. So as you may have heard or seen as we honor the 8th of March for International Women's Day, the global theme this year for International Women's Day is Embrace Equity. And as part of what we are trying to do in global health at Mount Sinai, we're trying to build equitable, long-term global partnerships in a few strategic places. And one of these is a long-term equitable partnership that we have launched in Nepal with several critical partners there. We at Mount Sinai are in a partnership with Dhulikhel Hospital and the Kathmandu University of Medical Sciences, which we refer to as the AMPATH Nepal Partnership. AMPATH stands for the Academic Model Providing Access to Healthcare, a model that originally was developed in Western Kenya, where I've worked in that partnership for about 20 years now. And we are attempting to replicate the very best principles of that long-term partnership in our efforts in Nepal. At the Arnhold Institute for Global Health, we're particularly eager to try to continue to learn and consider and work together with our partners and collaborators to understand how we can not only bring more equity to how we practice global health, but how our activities together in global health can move forward equity, both gender equity and equity for groups that are marginalized and oppressed in absolutely any area. I'm delighted to have with us two of the world's leaders in how health equity and gender equity are moving forward anywhere in the world, and particularly in Nepal. So let me tell you a little bit about them before we start this conversation. Joining us today, one of our guests is Dr. Sunila Shakya. Dr. Sunila is a globally renowned obstetrician and gynecologist and researcher who is based in Nepal. Dr. Shakya serves as the chief of the Division of Community Program Support at the Dhulikhel Hospital in Nepal, and she leads the cervical cancer prevention program, as well as the unit that's focused on the treatment of cervical cancers and precancers there. Much of her community work in Nepal has focused on expanding cervical cancer screening to women across rural Nepal, and her research has been published in many international scientific journals. She has also been a lifelong advocate for women's rights. Dr. Sunila received her Bachelor of Science from Tribhuvan University in Nepal and her medical degree from the University of Science and Technology in Bangladesh. She also completed a PhD from the Norwegian University of Science and Technology. And finally, she completed a fellowship in minimal invasive gynecologic surgery at the Vienna University. We're delighted to have you with us today, Dr. Sunila Shakya. We also are delighted to have Dr. Archana Amatya with us today. Dr. Amatya serves as the executive director of the Nick Simons Institute, which is a non-governmental organization whose mission is to innovate solutions for rural healthcare through training and hospital support, and to advocate for these innovations to be scaled up with the government of Nepal. She is a passionate leader. She has more than 20 years of experience and technical expertise in reproductive health and maternal and newborn health, as well as in health system strengthening. Dr. Amatya is also an obstetrician and gynecologist by training. She's a professor in the Department of Community Medicine and Public Health at the Tribhuvan University of Nepal. She holds an executive MBA from the Kathmandu University School of Management and a Master's of Public Health degree from Tribhuvan University as well. She completed her medical degree at the University of Dhaka in Bangladesh and also studied biology at the Amrit Science Campus. We are so privileged to have both of you joining us today, and I'm particularly looking forward to hearing not only about your own journey in terms of leadership in health and leadership in equity in Nepal, but also as leaders specifically in women's and girls' health. We're going to talk about some questions about how we might think together about closing the gaps in gendered leadership in terms of there being inequities in terms of who are the leaders, as well as thinking of some specific drivers of that, such as things that might prevent girls from attending school or from achieving the same kinds of professional success or even general health as male members of the population. So without further ado, let's turn to talk with these leaders as both women leaders in Nepal and leaders in women's health. Dr. Archana, if you don't mind, let me begin with you. Could you please share with us a little bit about the work that you have come to do and your journey to the Nick Simons Institute and what you are growing there?
Hi, thank you. Good morning, everybody. Good evening, and good evening here at this part of the globe. And thank you, Rachel. Greetings from Nepal. A pleasure to be here amongst all of you. And right now, I am working with the Nick Simons Institute. I assume that some of you must have heard about it. And as Rachel just mentioned, we work with the vision of serving people in rural health, in rural Nepal, and with innovative solutions and advocate for systems within the government of Nepal so they can be self-sustainable. And to be very brief on how we are working right now is we are helping the government of Nepal to train cadres which are required to give quality services, for example, and especially in terms of task shifting because of the fact that Nepal does not have adequate doctors in all specialities. So we have a kind of task shifting in almost many of the health disciplinaries, like, for example, anesthesia assistants or, biomedical engineer technicians. So that's one thing we are working on. And as you are aware, Nepal has different tiers of hospitals, starting from 15 beds till 100 beds. So what we are doing is we're working with the government so we can make these hospitals strong enough to give services, not only emergency services, but also regular services as well. And it's not only the number of services, but the quality of care is equally important. So right now, we've developed a minimum service standards, which determines what kind of standards should each hospital have, so they can identify the gaps and work on it. And of course, the Nick Simons Institute is continuing to work on research and advocacy for health system strengthening and human resources. That's in a nutshell, Rachel.
Yes, absolutely. There's so much there to summarize. Thank you so much for that. Dr. Sunila Shakya, now we know, of course, that you too are an obstetrician gynecologist, the leader of those services at Dhulikhel Hospital, particularly around work to expand access to women's health in rural areas. Could you tell us more about your work to bring health access and preventive services into the community and especially in rural areas of Nepal?
Thank you, Rachel. And first of all, happy Women's Day to all of us. Yeah, and then I should thank you for your generous introduction. Yeah, and to describe my work, especially I should say my work is mainly focused on expanding the women's health, but particularly in the promotive and preventive health, because in Nepal, I personally chosen the women's health though it was not my primary interest subject when I was an undergraduate. But what encouraged me and what made my work subject, my career subject, and my purpose of life is the women here in Nepal are suffering from the problems that is totally preventable, and that is what I have seen when I first went to the Dulikil. That was my first journey out of the Kathmandu. Yeah. And then, so my work is mainly on women's health, preventive and promotive health. And then, of course, the sexual and reproductive health in rural areas. And in this focus area, in this arena, my work with my team is in three major components. So if I have to say in points, bullet points, that is to develop the new cadres, especially the young ones, and to build them as a workforce and capacity building. That is what is. And next is, in order to support the government initiated and also our institutional initiated preventive and promotive health care service, especially in the cancer prevention, and particularly the cervical cancer, as you introduced me, and the breast cancer. And to make these services available at the health service centers in the government and also in the outreach centers of our institute that is expanded throughout the country. And then how to make these services make the women more accessible to them, one. And then next is to the population who are very difficult to reach, even to these health centers and outreach center, how to make these services available at their doorsteps, through the community health workers. So this is service point. And next three is, which I find from the very beginning, in order to reduce the health gap through health researches, especially focus on the women's health. This is the voice on the papers, to reach to the community within and also international. Yeah. So these are the three main key components where I work with my team. And then I proudly say, when I say I have with the team, my team consists of the, usually the women's working at the grassroots in the community, and the staffs in the health centers, and then the young, that is medical graduates, and the residents, because these are the people that I will be handing over the knowledge I have acquired, and these are the futures, to carry on with. Yeah. So since my purpose is for the rural, 50% of my activities, it's in the rural, and my physical and mental presence are in the community. So today, as you have introduced broadly about what we will be discussing, so I would like to highlight, it will be based on my work experience, from my personal and from my workforce and from my team. Thank you, Rachel.
Thank you. Thank you. I just wanted to I'll take a moment to tell the group of those who are joining us and listening today that we will have some time towards the end of this hour together where we would like to take your questions. So if you have questions for our doctors here, please feel free to write them in the question and answer box, and we will address those as we go as well. So I'll keep asking a few questions, but then we'll look to some other questions as well. Dr. Sunila, in what you described, you spoke so compellingly of how the challenges that women were facing, and especially in rural areas, were part of what it seems like compelled you into this work, even perhaps if it was not where you had thought you might end up being, or what you thought might be your path. And I really appreciate, as you've said, that you are coming to us with the voices of your team and of the community and the grassroots of what they are doing and what they are experiencing. Could you maybe tell those of us joining a little bit more about some of these challenges that women in rural areas in Nepal in particular are facing. I think especially for some of our listeners who are here in America with us may not be as familiar with some of those. And it's really our privilege to be able to learn from you today about some of the things where we can stand more closely with these rural women in Nepal as well.
So Rachel, there are lots of challenges, but with the continued effort and then joining together, it is solvable. Yeah. And when I go to the community, I feel like I learn more from them than I give it back to them. Yeah.
Yes.
So, for example, when I was doing promotive health education, for example, on sexual health, on sexual transmitted infection, gathering the women, and then you have to do this and cleaning and sexual hygiene and everything. One of the women said, I think whatever you are teaching us should be taught to the boys or taught to the men. I know it, but I'm so glad that they have realized it. Yeah. And then I said, why don't you do that by yourself, to your counterpart, to your husbands, and this and that. No, we are so close to each other, but when it comes to the sexual health, we are not open at all, and when it comes to the sexual health, it is us who they blame us. And if I tell them today I have learned these things, then I think the men will, kick you out of the village. Yeah. And then they will not send us, to this sort of education. We were just educating them with very with sensitive issue, but with lots of doing research, how to put the sentence, how to select the words, these things. Yeah, we have a sexual education package with the experts on sexual health and all that. Even then, being a very sensitive and very meticulous about what we say, to whom we say, how to say, where we conduct those, even then we hear that. So that means, we are advocating them, we are educating them, like I said, capacity building, and then service delivery, increase utilization. So in this step, the main challenge is, how to engage men and women, laymen and women, girls and boys, and the staffs, the men staffs and the women staffs together, in all these steps of community health. So this is the very, very big challenge, how to bring them together. And then one thing I could say, one of the challenge, for example, is, for example, the one point is cadre development and the capacity building. Yeah. So I'm the national trainer, and we are the National Training Center. When it comes to the women's health delivery, the new, the new initiatives, new programs, I find only the girls or the women are sent as a trainee. Never seen the men there, and then why only girls, say these things, and because it to be delivered by the women, the service to be delivered by the women, so the women's are at the delivering point of the service, and we are busy in delivering the services, never ending. And then what happened? The men's are there left over to lead us. That is the women delivering the service and men leading us to deliver it. So this is, though it sounds whatever it's so, but this is a very, very big challenge. So that means one of the things, the challenges, the women also telling this, and then and next is, if, for example, if the man checks you, examines you, will you allow then? Then said, of course, with the time it's changing. Even I do not feel bad if the man does it with respectable full. So in nutshell, what I want to say is the, equally involvement of the men and women, though the service to be delivered by the men. So the men also understands, our issues. And then next crucial thing why the men should be there is they are the, as I said, they are the leading person until now, So they are the decision makers, they are the leading people in the country. So they should be involved, not just in the leading position, so delivering position. So, the one is, for example, in the gynecological society, why the women's are only there are very few men, and then why there are only women nurses there, not men. So in the delivering side also, there is only the women's are there. So this is one of the very challenging part. Yeah. And this is I find it as a core thing. So which determines all the challenges also, and of course, there are socio-cultural, economic determinants of the women's health. That is lots of challenges, which includes, as you said in the introduction, the equity, the gender equity and all that. Thank you, Rachel.
Thank you. Thank you. That's a very helpful overview as well. Dr. Archana, in your, I know you have done as you described, and as the work of the Nick Simon Institute has focused on also, work related to access to healthcare and thinking about cadre of healthcare workers that might be trained up and how to continue to bring services at this level to the rural communities. Can you perhaps add certain challenges or issues that you see from a gender perspective or lens as well, similar perhaps, or maybe some additional things we might consider to what Dr. Sunila has shared also?
Yeah, thanks, Rachel. Actually, Nepal faces many sexual and reproductive health challenges. There's a lot of gender disparity and other discriminatory norms in the Nepalese society. And, you would be surprised to know that even though child marriage is legally prohibited, yet 1 in 4 girls are married before the age of 19, which means that the median age of marriage is about 7 point something, and which leads the adolescent fertility rate to be very high, especially in the rural areas. So that itself is a huge challenge for us, because these norms are kind of accepted in the society and is a must, So because of this, there are a lot of dropouts in terms of education. Maybe they do get educated only to a certain level. So it's like almost less than half of these, the girls and the young women have adequate knowledge about their hygiene and the practices, good practices. And because of that fact, they have the inability to effectively manage their health, the menstrual health, the general health as such, which has direct relationship with their education and the physical health, and not to mention the psychological and the emotional well-being and the general quality of life in general. And yes, it's a huge challenge, because there's cultural norms which have been embraced for generations to generations. Even in the most elite society, we would still find that kind of barrier still exists even today. Like, for example, if you're menstruating, you're not allowed to go in the kitchen, or probably in the prayer room, or probably touch your brother or your father, or go in front of the men. That kind of inequity is there. And to be very honest, in certain villages in Nepal, even right now, there is a menstrual seclusion practice, of the girls living out of the house during the menstrual period. It's come down drastically over the years, but nevertheless, it does exist according to traditions and beliefs, and these restrictions are there. So these are challenges which have, I came back to Nepal after my graduation 20 years back. And that time, the scenario was very different from what it is right now. But yet, in spite of that, the stigma still remains. And there's a lot we need to do to gap this, decrease the gap for gender equity. Over, Rachel.
Sure. I think you've highlighted a really important issue for us to consider today. And again, one that some of our audience may not be as familiar with in terms of the extent of this specific stigma around menstruation. And just as you've described, that there are still these very specific prohibitions that may be in place related to the stigma of menstruation, that you would not be allowed to do certain things, to touch certain things, to participate as fully in even in your home and family life, as well as in society. And that persists even, to some extent in certain places still, with this menstrual seclusion, where those who are menstruating actually are physically away in a place, but that even if that is not the extent of it, that there are still these very exclusionary practices that girls and young women would be experiencing at the time of menstruation. I wondered, and certainly as you've described, there have been changes in this over the last few decades in Nepal, but of course, having that kind of specific stigma around menstruation continues to impact whether girls are attending school during that time, or what they're allowed to do or not do in that time. I wondered whether you might describe, either of you, any ways that perhaps you have seen effective interventions or things that have worked to try to reduce that stigma around menstruation a bit. Sometimes when we have these things that seem so ingrained in our societies and so big and just so longstanding and pervasive, I think for me at least, sometimes I feel like, how will we even change this, or what can be done? And it's so important if we can look at ways that even if the progress is not as far as we would like, where we've seen some progress being made. And I wonder whether either of you have examples of that, or ideas of things that you think would continue to push further against the stigma around menstruation.
Shall I go first, Rachel?
Sure.
Yeah, please, Dr.
Yeah.
Archana.
Okay, yeah. Well, when you were saying this, a couple of things came to my mind, and where these, especially these activities have been done, but yet to be done more specifically. For example, I have a couple of examples. At one point of time, the education system in Nepal did not talk about sexual and reproductive health at all. Forget about menstrual health. But
Sure.
over the years, there's been a change in education and in the curriculum itself, that sexual reproductive health is a part of the curricula. But we still need to work more on that, because I remember my son's when he was in high school, his teachers used to call me to give lectures on sexual and reproductive health, because the teachers were not so well versed, and the students had so many questions that the teachers were not able to answer, So that education on sexual reproductive health has to be given more emphasis, in my opinion. Another very important thing which is being done in the country is about improving sanitation, because as long as we have poor sanitation facilities, reproductive health, menstrual health is not going to improve at all. And, I was just going through one study which showed that only 28% of the public schools had separate facilities schools with toilets for girls. That's one in 4 schools probably. And that's really bad, because until we do this, we cannot improve the health of women. And sanitation facilities is another very important thing. And along with this, this fear, confusion, and concern at the time of menstruation is one thing we really need to overcome. And I'm not sure how we're going to do it. Education, awareness could be one which is being done, but I think there's something else missing to improve on this, because until, girls have the confidence that they can manage their menstrual hygiene, we still will be, there's still going to be a gap. And it was surprising to me to read in one of the papers that only 70% of the menstruating girls were only 20% were using sanitary pads, and the rest were using cloth. That was very, it was not good news for me, you know. So I think that's a couple of areas where we can really work on to improve the menstrual hygiene. Over, Rachel.
Yes, you know, I don't think I mentioned it at the beginning, but I'm a pediatrician by training, and much of my own work, both clinically and in research, has been focused around children and adolescents who are living with HIV, which of course, you know, HIV is a very stigmatized condition. And in East Africa, where much of my work has taken place, we continue to wrestle with those impacts of stigma that get internalized, and where that impacts your view as an adolescent and young person growing up with a stigmatized condition in that way, you know, how it impacts your view of the future, of what's possible for you, of your mental health. And I think as you were describing, there are of course these really important structural and systemic things that need to be done. Hygiene, you know, bath and you know, facilities for toileting need to be in place. We must have the educational pieces and the knowledge being shared, but also how to you know, not only move beyond those, and you know, and even thinking about just providing appropriate supplies for menstruation potentially, but also how do we move beyond that, you know, that feeling of, you know, shame of having been stigmatized or carrying this weight that girls have as they, you know, both because of what they don't know about menstruation and how the body works and what healthy functioning is, as well as those societal concerns as well. Dr. Sunila, I would love to hear as well from you, and especially thinking about, you know, many of the rural communities in which I know you are so immersed as well. Perhaps both some of the challenges that you see with this on a daily basis, but also whether there are any ideas for things that can be done to continue to improve our understanding and improve the status for girls and people who are menstruating with this.
So what I have learned from the community while I'm educating them or working with the women is, for example, one of the women said about during the pregnancy, we do not have menstruation, yes? And then that menstrual bloods accumulate and accumulate and accumulate, and that becomes the baby, you know? This is what it is, yeah? And then this is among the adults, yeah? One of the adults said, I still remember. And then the other said, it is the impure blood, you know, that goes out. It's an impure blood that goes out. That's why that impure blood should not be dropped anywhere. Yeah, that's why we have to be isolated. So since the impure bloods are circulating at that time, you know, we are not allowed, we should not do, you know, any religious rituals, or should not touch our husband or so, these things. No? These are from the adults' perspectives. And from the, when we also have to do the school health. And from the school health, I find, you know, the children are very, very anxious and very, as their menstrual period approaches, you know, they are so scared.
Yeah.
Yeah. And then, since in the pubertal period, in the perimenarchal period, this the periods is not regular, and then they are always, all the time there are fear, you know. And they said that they always hide their menstrual product, you know, in their bags, and so scared that someone will find them out. And then, and they always feel uncomfortable. So the anxiety surrounding them, it is there. Yes. And then they also say that maybe a month from where the blood comes, you know, from where the blood comes. So that means from the children to the adults, about the menstrual health, they are totally blind. They do not know about it, you know. Even the school going girls, when they reach at we start talking about the menstrual health from class 6, yeah. So they do not even know about their reproductive organs and then how it is happened. And but the interesting thing, So once we know what they don't know, so we know how to, you know, what we should deliver them and how to do that is again the experimental. So what we do is usually, I find it at the very beginning, I find I give the education only to the girls, you know, okay, girls, you know, today is the girls' education day and the minstrel. No, it doesn't work. We should educate the girls along with the boys together, you know, about the menstruation. Yeah, this I find it very, very, very effective. I find it, yeah. So we are going to publish a paper around that also. That's why I also said, you know, the biggest challenge is, you know, involving the boys around. So at the very beginning, it was very awkward for the girls, you know, to talk about it with the boys. But since I did the primary teaching before my undergraduate medical school entry, so I find very fun teaching the children, you know. So that was very helpful for me, making a fun, you know, at the same time, and teaching them, and usually again using the anatomic models, very beautiful models, you know, about the uterus and how the shedding of the endometrium happens. It is very, very effective. So what happens is to make these talks about the menstrual hygiene very open, you know, not to make it easy to talk about this, you know, so that the boys also know, okay, these are the days the girls have a little bit difficult time, you know. It is nothing too shameful about this. Is usually, it's very, very important cycles in one's life. You know, so we have a very, very beautiful capturing videos also, how the boys expressed it, you know, after knowing it. So this is very, very interesting. And also for the for the children not going to the school, you know, even in the village, though the boys were sitting at the corner and the girls were, but so involving and talking openly to them. And again, to the this women's group and female community health volunteers are now a little bit coming forward, talking openly about it. So the main thing is education, education, and education, you know, and then not just theoretically, make them, you know, more visible, using the different teaching models. This is, and possibly involving the men also, teach them, you know, about that. So it is about the teaching, and of course, as Dr. Archana said, it is teaching, of course, then make an environment, you know, safe for the girls, so that they feel convenient even during the periods, and they don't have to drop out of the school. So that is it. Thank you, Rachel.
Thank you so much. And I think your call there for education and what that education might look like, that it's not just, you know, a simple thing of having a different kind of textbook, but that it really means, you know, going to the children of both genders wherever they are and throughout these ages, as well as the adults and with community leaders. These are such critical points. So thank you. And of course, thank you for your work to continue to move forward that critical education as well in that way. You know, one of the things that both of you have brought up in different ways are related to schools and the health of those in schools. And one in our partnership with Dulikhel and with Kathmandu University School of Medical Sciences and Mount Sinai has been also with the ministries around the school-based health efforts in Nepal. And we're excited that there is an effort to try to expand probably province by province, but ideally eventually nationally, efforts to have health services accessible at schools for adolescents. You know, and I think because of the issues that you're describing for adolescent girls and young people, as well as for the adolescent boys and how that fits in there, that could be an important way to, you know, to provide more full services for adolescents as well. I wondered whether either of you have additional ideas about, in addition, of course, to what we're talking about with health education around menstruation and sexual health, and both the education and potentially services related to that, other ways in which schools could be an opportunity for either health education areas that might be critical for adolescents, especially with this idea of what would build more gender equity in this next generation, whether in education or in health services that might be provided in schools, where you might have some ideas or suggestions based on what you've read or seen or experienced in the school system as well.
Yeah. Can I go on that, Rachel?
Sure. Yeah, we can.
Please,
Yeah.
Archana.
Yeah, right. Well, it's very clear that, when adolescents are more knowledgeable about their bodies, their fertility, and their ability to effectively manage their menstrual hygiene, they become empowered. That's the bottom line, and it is there where we need to, make them more equipped with information, with tools, with confidence, which is necessary to manage their long-term sexual and reproductive health, as well as menstrual supplies. This should be our overall target. And I was just thinking, this is something which has to be multi-sectoral, because we are talking about health, yes, no doubt, but at the same time, I think that especially in Nepal, it's water and sanitation, it's health, it's the Ministry of Education, and
Sure.
then the Ministry of Women, Children, and Social Welfare, what we name it here. And I think, unless we have this multi-sectoral approach, I do not think we will be able to reach our long-term goal of, of decreasing the gap in equity. And currently, it is being practiced in one way, but not as much as I and you would want it to be, because I think there is still a gap on deciding who's responsible for which part of equipping them with information tools and supplies. So I think that's one important area we really need to work on together.
Sure. Dr. Sunila, ideas from your side?
Yeah, you see, today's adolescents are tomorrow's adults.
Mhm.
Yeah, and why we are facing today the gender gap and all these are because when today's adults, when they were adolescent, the priority on these health issues, and the gender gaps, what has to be done, was underlooked, was not looked properly, so now it is before it's too late. It is very right time that we should invest, in any way on these adults,
Yes.
to make them empower, and then most importantly, to make them partners, like we say, oh, they are still adults, they are not mature enough, to give their opinions. No, they should be counted as a partners in every steps of development, in every steps. That's why, for example, I can, because I'm not in that, level, but since I'm working very close with the community, yeah, what we do, like we give them the platform, to speak about, yeah, feels like they are the leaders at that moment, so that they can talk about it, yeah. So make them the platform, so that they can put their voice. Like, for example, though I do my health teaching, on one subject, so I asked one of the audience, okay, let's talk about this, what you feel about, let them speak their voice, these sort of things. That means to make them partners in everything, so that investment on these youngsters are the innovative for future development. Yeah. And yes, this is what I can say. And there are lots of things to talk about.
Yes. I just wanted to remind our group joining us that we would love to take a question or two from the group. Feel free to write those into the Q&A box that you have there if you have a question for our group. I have a question that I wanted to ask both of you that maybe doesn't sound quite so serious, but I think you have good ideas for this. If you had a magic wand, so to speak, if you could set a goal or a few goals that if you could make them happen. I would love to hear from each of you from your perspective, what you would set for changes in gender equity over the next few years, especially with what you're seeing. What would be some priorities for you to change in that way with your special magic wand that we would give you? Dr. Sunila, would you like to maybe start?
Yes. So the one thing that I would change, is again the involvement of the men.
Yes.
Involvement of the men in every aspects of the women's health care. One is, and to make visible what's the status of the women's health care, then in order to make it visible, the health disparity, so the more researches, around the women's health, because when we do more research, it's all the women's participation in research, for example, are always undermined, because the same disease, but the biology of the women's are quite different. So the women's the variability of the biological variants can be different, in the outcome of the same disease. So that's why, I would do more on the field that we have been doing, like a health gap, whatever it takes to decrease the health gaps, and through the research on women's health and the men's, this one, because this I have been, talking with a lot, like, why should we have only women talking on the Women's Day? Like, these sort of things, like, for example, today the one person say, oh, today is the Women's Day, then you people should talk. And no, we will talk, now 364 days, and one day you will talk. This is just a type of irony. Yeah. Thank you so much, Rachel.
Absolutely. Yeah. Thank you so much. And I think that's such an important set of inclusions across the board there in terms of things that you would change. I mean, even bringing up, as you very rightly said, how often, women are left out of or not proportionately represented in research work and all the things, therefore, that we don't really, know the ways in which, medicines can work most effectively for us, how to prevent and treat diseases for us. It's too often, extrapolated from what's known from either men or, even from animals and different things as well. Dr. Archana, your magic wand is now in your hand. What sorts of changes would you like to see?
I was just listening to Sunila, and I agree with 100% about the involvement of men, And in this part of the region of the world, we've tried so many things to decrease the gap, especially for reproductive health, the sexual health of adolescents. We've tried teaching, getting it into the curricula. We've tried community health volunteers going on to it, teachers, peer, having separate rooms for adolescents for them to help give healthcare. But, somewhere something is not matching 100%. So I'm just hoping that, if I had a magic wand, I would try to find an alternative way to reach out so that, we could leverage and establish a lifelong conversation about sexual and reproductive health. That's lacking a lot. And somewhere I feel that the involvement of the parents has not been very 100%, although maybe the mother might be involved more, but less of the father. But then girls tend to be more close with their father. So that involvement is there. And I was also thinking, because everybody is so techno-savvy these days and they rely on the media so much, I was just thinking whether the media could be harnessed to give positive public opinion, because that goes even faster than community mobilization, and especially, when we are addressing harmful practices and good practices. So as in the rest of the world, media has a big role to play in giving negative publicity, but I think if we could give it in the right direction, this would definitely be very, very helpful, because you'd be surprised, 95% of the population have a smartphone, even they're just having one hot meal a day. That's surprising, but that works in certain ways. Yeah.
Sure. And I think you're right in terms of harnessing, every potential tool, and of course, the ways in which these influences, whether it's the media or, even thinking of how we sometimes treat the relationships with parents or others, where there can be things that are negative. And the more we can do to make these positive and supportive influences, the better, absolutely, in that. I see we do have one question, which we've touched some on the issues of menstruation and how the stigma around menstruation really impacts the lives of girls and women, and some of the things we might do about that. The question is specifically about the concept of period poverty. I think the ways, whether we want to think of the ways in which, there are financial burdens around this, and of course, the ways in which those in poverty are disproportionately at times impacted by the issues around menstruation. Perhaps could one or both of you maybe talk about this in response to the question, how this affects young girls in particular in Nepal?
Yes, Dr. Archana, may I start?
Yeah, sure.
Yeah.
I'll add if I have anything.
Yes. When I was menstruating, start my menarche, and then now also, when I talk with the girls, there is still a financial problem, to buy it. Yeah, the products. Yeah. And then, it is not that cheap. Yeah. For example, the cheapest one is rupees 40. Yeah. So Nepali rupee. And for a girl who do not have her own income, it depends upon the pocket money from the parents, and that parent hardly put her to the school, So how can she afford it? One thing. And then the next is, so this is based on the conversation I made with the girls, and then, okay, let's forget about the product. Then what about the reusable, the sanitary, menstrual hygiene products are there? Then said, yeah, it's good. But, again, it takes our time and the water, and then we are so ashamed of where to make it dry. And then when we are going to the school, then who will pick it up and then put it, in these things. So it takes half our mind during the menstruation is how to maintain it, how to wash it, these things. Yeah. So there is a economic, issues related with these products also. So we really have to think of it. And so according to the girls, when I say about ask them about what you wish, and said, now they have a reusable menstrual products are there. So my mother knows about it. Then she do not even give me the money now to buy this disposable one. So she always said, now you have a washable, reusable one, why you have to do it? And they said during the exam time, it's very difficult. And for going to the school, these reusable products, it's not friendly. We need to change it, where to put it, these sort of things. So, so we have to make available the different products, different types, so that the children can choose according to their availability and according to their situation. So these are the things I would highlight on the basis of my recent dialogue with the girls. Yeah, thank you.
Thank you.
Yeah, if I may add, Rachel, there was a study where with the objective of finding out what kind of pads to adolescents use during menstruation. And it was interesting to see that, 1 in 4 still use a cloth. And as Sunila was saying, the fact that the sanitary pad, disposable sanitary pads are so expensive in the country, that is a huge challenge. And I think it's very important that, that we really need to develop and market cost-effective pads, are probably at no cost at all, in fact, especially for individuals who are living in rural areas, because this is a huge challenge for the country. The work has been done in bits and pieces, and local made sanitary pads. They're taught in schools, done by the teachers and by the adolescents themselves, but it has to go in a whole blanket approach, especially for the rural areas. Until we address this, until this is addressed, the poverty period is going to remain as it is right now, and we will never be able to achieve the hygiene of what we are all talking about.
Absolutely, absolutely. Well, thank you. I'm aware that our hour together has passed quickly. And of course, it is actually quite late in the evening for both of you in Nepal as well. So we especially thank you for joining us, not only giving us your time, but giving us your evening time on this International Women's Day. Thank you so much for joining us and for not only what you've shared today and helped us to consider related to the issues of gender equity in Nepal, but of course, thanks to both of you for the incredible work that you are doing to really improve healthcare and raise up the status through healthcare of girls and women, especially in Nepal, whether that's with boys and men or with girls and women directly, but truly you both are doing that work. Let me just remind everyone that we do post the recordings of these discussions, and that will be available online. That if there was something or it's of interest and you'd like to share it with friends or colleagues, the recording will be available probably in the next day or two on the Mount Sinai Global Health site, where we have the YouTube recordings there. And again, we just thank you so much for your time as well. There was a note in the chat if anyone listening happens to be interested in donating towards these efforts to move forward the healthcare access, whether in education, in healthcare services and research for girls and women in Nepal. You are of course welcomed to offer your financial support to these efforts as well. And we continue to hold up these very specific needs in terms of menstruation, of coping with access to sexual and reproductive health as high priorities for what we hope our partnership will be able to continue to grow, lend our work and our voices to. Again, thank you, Dr. Sunila. Thank you, Dr. Archana. It's been lovely to hear from you today, and we hope that your evening goes well in Nepal. Thank you.
Yeah. Thank you, Rachel. Have a good day. Bye-bye.
Bye.
Bye.
Thank